The threat posed by the swiftly spreading Zika virus to the Caribbean, North and South America has spurred scientists into action to find a cure for the mosquito-borne disease. However, the anxiously awaited medicine will not be realized soon enough. According to researchers at the University of Texas Medical Branch, while the vaccine could be ready for testing in another 2 years, it may take at least a decade to be approved for public consumption. The researchers visited Brazil to collect samples, which they are now analyzing at their high-security labs in Galveston, Texas. Brazil is basically ground zero for the latest outbreak of the Zika virus, which is transmitted by the Aedes aegypti mosquito. With nearly 4,000 Brazilian babies being affected by microcephaly, a birth defect which results in abnormally small heads in newborns and lifelong health issues. Studies are now on in earnest to ascertain if there is a correlation between microcephaly and Zika. And with at least 20 countries in the Americas confirming cases of the virus, the World Health Organization has cautioned that the disease could spread to nearly all countries in North and South America. The Aedes aegypti mosquito is regarded as a domesticated insect which breeds in puddles of water and garbage in and around homes and communities. Therefore, residents are being urged to wear protective clothing, use repellents, and keep their surroundings clean. The symptoms of the Zika virus, which are usually mild, include rashes, fever, conjunctivitis or red eye, muscle and joint pain lasting for 2 to 7 days. In news from Jamaica, health officials are warning citizens to take the threat of the Zika virus seriously. The warning follows the World Health Organization (WHO's) advisory this week that the disease will likely spread to every country in the Americas. More from Carrie-Ann Lowe.
The Americas has been placed on high alert for the mosquito-borne Zika virus. Director General of the World Health Organization (WHO), Margaret Chan, has warned that the disease is likely to impact all countries in the Americas except for Canada and Chile. So far, approximately 24 countries in the Caribbean, North and South America have confirmed cases of the virus, including Brazil, Colombia, Venezuela, Puerto Rico, El Salvador, Panama, and Paraguay. The new disease has sparked heightened worldwide concerns and prompted the Centers for Disease Control (CDC) to issue travel alerts to persons, especially pregnant women, to avoid traveling to Zika-affected countries. Caribbean territories are also being advised to take adequate precautions in light of the public health threat. Zika has been identified in Guyana, Barbados, Haiti, Suriname, the U.S. Virgin Islands, Martinique, Guadeloupe, and St. Martin. At a press conference on Monday, the Caribbean Public Health Agency (CARPHA) reiterated the need for the region to become proactive in the fight against Zika. CARPHA noted that the region is at risk due to the high volume of people who traverse the region's ports regularly, as well as an abundant mosquito population. The regional health institution is urging citizens to destroy possible mosquito breeding sites around homes, wear long clothing, and to utilize mosquito repellents and screens. CARPHA is also imploring pregnant women to be extremely careful and have even echoed sentiments of other World Health bodies encouraging women to delay becoming pregnant for at least 8 to 12 months. The Zika virus is transmitted by the aggressive Aedes aegypti mosquito. The main fear associated with the disease is its reportedly devastating impact on newborns. The virus is strongly believed to be linked with a neurological disorder known as microcephaly. In Brazil, there have been at least 4,000 reported cases of microcephaly since 2015. Microcephaly is a fetal deformation that limits brain development, leading to babies being born with abnormally small heads. Zika hasn't reached the Caribbean island of Jamaica as yet. However, Health Minister Horace Daly says the Aedes aegypti that spreads the virus has been spotted in several parishes.
It's high in Jamaica. It has always been here. And there are some specific communities that last week we visited, high indices of the mosquito, of this particular mosquito. High communities. Kingston and St. Andrew has the highest indices. St. Thomas, St. Catherine, Clarendon, Manchester, and Westmoreland.
Entomologist in the Ministry of Health, Mrs. Shireen Huntley, says tires and drums are among the major breeding sites for the Aedes aegypti mosquito. She issued this message to operators of tire shops.
Even though we have several breeding sites for the Aedes aegypti, we have found from our surveillance data that 45 to 55 gallon drums and the tires are our major breeding sites. We want to make an appeal to our tire shops that we know you have to carry on business, but we ask that you store those tires so that they do not breed mosquitoes. We have many tire shops across the country, and tires and these 45-gallon drums are our major breeding sites. And we have found as well from our surveillance that persons are just not taking action because we continue to see a high population of the Aedes aegypti mosquito when our teams go out.
In the meantime, Jamaicans are also being encouraged to monitor their surroundings and destroy potential mosquito breeding sites. Health Minister Horace Daly explains that pregnant women, infants, and the elderly are among the at-risk groups.
In the coming week, we'll be meeting with several other partners, including the Umbrella Group of Churches and the Private Sector Organization of Jamaica, just to name a few. Our teams will be present in the field to guide communities and householders in terms of destroying mosquito breeding sites and keeping their surroundings clean. Infants and elderly persons who have diseases such as diabetes, arthritis, cancer, sickle cell, or are a compromised immune system are also at greater risk for more severe symptoms, and so we urge that special effort is made to protect this group. Community mobilization, sensitization, and education is key. You will recall that we started a community focus program utilizing young persons in December, where we deployed about 1,000 workers and still being deployed all across Jamaica to help with the public education of our citizens. Yesterday, we officially launched an initiative with the Caribbean Cement Company, which will see an additional 100 young people deployed in the KSAC, Kingston and St. Andrew, along with the Kingston St. Andrew Corporation. The ministry will train the youth who will undertake community interventions in the corporate area, including education about the Zika virus. This will bolster effort at the community level. We'll be calling on other companies to come on board to work together with health to minimize the impact of Zika virus on the population, our country, and our economy.
Permanent Secretary in the Ministry of Health, Dr. Kevin Harvey, says cleaning exercises by citizens should be ongoing.
We can't do it this week and not next week because the mosquitoes hatch almost daily. So we're asking that persons make this a routine part of their schedule and will do these assessments on a weekly basis. We ask that you spend at least 10 minutes every week to go through and check your yard, your house, your community spaces to ensure that there's no breeding occurring.
I'm Carrie-Ann Lowe for CEEN Caribbean News.
And while Jamaica is on V alert, some citizens are still reeling from the effects of the chikungunya virus. Permanent Secretary in the Ministry of Health, Dr. Kevin Harvey, says CHIKV is now endemic to the island.
CHIKV is now endemic in Jamaica, so we will always have cases from here on. We have sporadic cases. You may have one every a month or so, but there is CHIKV circulating in Jamaica and will be here forever and ever from now on. There's no epidemic or outbreak of CHIKV at this time, and hence it's just sporadic intermittent cases.
The same mosquito, the Aedes aegypti, transmit the Zika, chickpea and dengue virus. Dr. Harvey is cautioning citizens that all viruses carried by the Aedes aegypti mosquito have similar symptoms.
Well, there's dengue as well, and there are 4 different types of dengue. There is chickpea, and it resembles the flu as well, and this is the flu season. So there's a lot of things that you could mistake it for. The critical thing is to look for some of the distinguishing features like the conjunctivitis, the redness of the eye, but the redness without the pus. When you have pink eye, you get a pussy red eye. But when you have chickpea, it's just a red eye without the pus and some of the other symptoms. So you have to look out for that. And, you know, so far we have not identified Zika in Jamaica, despite the cases that we have investigated and tested. Once it gets there, then, you know, we have to do more testing, etc.